Hi, this is Dr. Antolak from theGentalDentist.com in Shelby Township, Michigan. One thing that we do at our office is we place dental implants. We not only do cosmetic dentistry, but we want to do some things to replace teeth. Dental implants are, for example, if a tooth is missing, and in this example it'll show a tooth that's missing, what we want to do is to put something in there. The old alternatives, really the alternatives that were there, were to do what's called a fixed bridge, is where you would grind around one tooth, you'd grind around the other tooth, and you connect them all with one piece that would go in and get cemented in place. Well, actually that was something in the past, but over time it has become much more really clinically acceptable and almost a treatment of choice is to replace a single tooth like this missing with a single tooth or something like that. And so we have our dental implants that would go, let's say for example in this patient's case, a tooth is missing, then we can put, it's made out of titanium, and you can see that this is the implant right here that would go into the jawbone. When it gets put in the jawbone, the bone actually heals around that. It takes between 3 to 4 months for that bone to heal around it, and then it's strong enough to support a tooth. So if a tooth is missing, for example like this, even during the same visit, if a tooth has to be removed, we can place an implant into the jaw, and it would go in to a certain level. Obviously this one is shorter, but that would get screwed into the bone. And actually it does not hurt when this is done, because bone does not have any nerves that can sense pain. So the only part that bone senses when, for example, when any surgery is done, is the soft tissue, the gums that surround it. In those areas there are nerves that can sense that pain. And so during the implant insertion part, there's no discomfort at all, even with just local anesthetic. It works just fine. Then on the top of that implant, which is really right here between my fingers, that part is called the abutment. That abutment actually unscrews. This would unscrew from here, from this implant, and then that abutment then looks like a tooth itself. So that would be the part that would stick out, and then we can create what's called a crown that would go then get cemented over the top of that abutment. So there's really 3 parts to an implant, dental implant. There's the implant itself, there's what's called the abutment, and there's a crown that goes over the top of that abutment that would then fill in this space where the natural tooth is. What you want to do is, it's really critical to then be able to floss your teeth. So by doing that, you can floss between each tooth as if it were a natural tooth. It is a 1-to-1 replacement, so we're not affecting any other teeth when we do a dental implant. Dental implants are, like I say, there's really no discomfort at all to speak of, and they are something that has been really tested for a long period of time. One thing that does happen with implants is that they will help to maintain the bone. Just like with a natural tooth, like I just pulled out on this model here, there's roots that are on there. Those roots, just like an implant, if those are in the jawbone, that helps to stimulate the bone from within inside, because bone is living tissue. That bone will maintain its health and integrity and not shrink down. If a tooth is removed, then over time this bone that normally exists in this area will start to shrink and get smaller and smaller. The teeth will also shift back into trying to, as the space collapses and the space gets smaller. When that takes place, we start getting food that develops between the teeth, and then there's just a whole collapse of the mouth and the function and how things used to function. So if you need a tooth removed, really seriously consider replacing that tooth with a dental implant, because an implant will be your best alternative, in my opinion, and that's the opinion of most dentists actually. And it also, like I say, it helps to hold the integrity of your tooth. So if you have any questions about that, you can give us a call at 586-247-3500. We're in Shelby Township, Michigan. Thank you.